Everyone, let's discuss an interesting case of gingival enlargement. A 28-year-old patient came to our OPD with a generalized gingival enlargement. It made me pause for a moment because the first causes that came to my mind were plaque and calculus or drug-induced gingival enlargement. On examination, there was no obvious heavy calculus visible, as you can see in the picture. The patient had no history of bleeding while brushing. The enlargement was generalized. Then I asked the patient about his drug history, but there was no relevant history of medication associated with gingival enlargement. I performed scaling. However, the enlargement didn't subside completely. Since cervical third was covered by enlarged gingiva, it was affecting patient aesthetics, so we planned gingivectomy. During the procedure, a heavy deposit of subgingival calculus was hidden beneath the marginal and interdental papilla. This chronic local irritation is the actual cause of a chronic inflammatory gingival enlargement. This case reminded me that whenever we encounter something abnormal in the oral cavity, as dentists, we should be able to think of all of its possible causes. So, the question should arise in our mind, why? Why is this happening? Then we can diagnose and plan appropriate treatment. Here is the classification of gingival enlargement according to etiological factors and pathological changes and according to location and distribution. Thank you for watching.